The VA and the Department of Defense have had a memorandum of agreement that goes back to 1993 for the VA to do complex rehabilitation for individuals with traumatic brain injury, spinal cord injury, and visual loss. And now more recently, polytrauma is getting added to that list. So in the VAs, in particular in the lead polytrauma centers, we are able to treat active duty service members. Where in a VA hospital, generally, you're just treating veterans. That has led to really tightly integrated care for our active duty service members with severe injuries. When we think back to many of the patients that we've treated, we're actually able to treat with our colleagues at Bethesda, or now it's Walter Reed, really hand in hand. So the surgeons on their end continue to manage their surgical issues of the patients while they're 110 miles away at the VA. We have frequent teleconferences. We get them back up there for surgical appointments. But you'll see an incredibly coordinated effort by medical and surgical teams and intensive rehabilitation teams that actually aren't on site. The level of collaboration that I see is better than I have seen in any hospital where all the people are in the same building. So it gives us the opportunity to treat these folks and really manage them through that challenging period of time. So it does break the mold to some degree, whereas, you know, in past generations, when service members went to the VA, they figured that that was the end of their career and they were getting pushed into civilian life. Whereas now we're able to work, like I say, hand in glove with the DoD to get these folks back to hopefully the highest level of function that we can. When we talk about length of stay in the polytrauma centers for individuals who need intensive hospital-based rehabilitation, their lengths of stay can be really across the board. We run comprehensive evaluation programs for service members. So those are the walking wounded who are not really doing well in community. We'll come in for 2 to 3 weeks and we look at them from every angle that we can to try to help them find things to rebuild their lives with. Individuals typically who are severely wounded will be there anywhere from 2 to 4 months generally on the inpatient unit. While they're on the inpatient unit, we have their families there with us. There's Fisher houses at all of the VAs, and the families are really part of the treatment team. We have no visiting hours on the units. They can stay with their loved one if they want. I know at our VA we've had 2 weddings, we've had multiple births, we've had all kinds of life events that we try to help encompass. So those service members who are severely wounded will be on the unit anywhere from 2 to 4 months. There is even a more severely wounded population, and those are the individuals in our emerging consciousness programs with disorders of consciousness or near coma after a severe brain injury. Those individuals typically will be in our units anywhere from 3 to 6 months while we try to help them recover consciousness and recover any kind of function. After individuals with severe traumatic brain injury have been in our inpatient unit, at all of our lead polytrauma centers, we've got community reentry based transitional rehabilitation programs. So these are, past working on the basic activities of daily living. This is working on their, really ability to take their medications and to do their laundry and to get back on a work site and to manage the complexities of not being a patient, but hopefully being a person again at some point in life. So, the length of stay on those polytrauma transitional rehabilitation units is usually anywhere from 3 to 6 months as well.